My name's Tim Byers. I'm a professor of preventive medicine at the Colorado School of Public Health, and I'm a physician, but I do work in cancer prevention and teaching about public health and cancer prevention. I think the newly diagnosed person with any cancer, especially colon cancer, is faced with this storm of issues. Concerns about, am I going to live or die? Am I going to suffer? What's the effect of this going to be on my family? What are the financial effects going to be? What are the long-term issues? And the storm of issues that usually comes at a time in life where we're not ready for it, because there's all this other stuff going on in our lives, can be overwhelming for people. But what I'd say in the midst of that storm, the most important thing for people to do is to feel really confident about the quality of the medical advice that they're getting. There's a lot of choices. What kind of surgery? Should I have chemotherapy? Is there some other kind of treatment that I need? And feel really comfortable. Sometimes that requires a second opinion. Sometimes that requires a third opinion. So I think that's the first thing. Get really grounded in your health care advice. And then proceed with treatment, but don't rest too much. One of the problems that happens with cancer survivors is that in the course of their treatment they begin to rest, which is natural because they feel tired and fatigued. But then that can be a vicious cycle, and if they don't get out of that with increasing physical activity, quality of sleep drops off and the fatigue continues and becomes chronic. So I'd say be physically active as much as you can through your cancer treatment, and certainly when the primary treatment is over. Improve your nutrition. Try to stop weight gain if you've been gaining weight, and paradoxically through cancer treatment, in fact most patients gain weight through their primary course of cancer. We think of cancer as being a weight loss opportunity, but for many it's not. It's actually a time in life where they gain a lot of weight. So be physically active, improve nutrition, and then finally just pay attention to the psychological and spiritual opportunities that present themselves in the course of cancer treatment. The extra support that you feel from family and friends is real, and I'd say dwell in that and use that as an opportunity to grow psychologically and personally and spiritually through that experience.